Tomorrow is National Wear Red Day to raise awareness for women's heart health.
22 News reporter Alana Flood joins us live in studio. And Alana, you spoke to a doctor today about how heart disease can be a little different for women.
That's right, Nick and Ciara, I did. And it was surprising and frankly a little bit frightening to hear doctors say that heart attack symptoms in women can be very different than you expect.
Women get the different signs than the men do. And they could be signs that are, could be something different than what a heart attack is. So I don't ignore anything now.
Heart disease is the leading cause of death for women, responsible for 1 in every 5 deaths. Despite this, it can be very hard to detect. When women have heart attacks, it looks a lot different than what you expect.
Women, it can be very different. They can present as indigestion and back pain and feelings of nausea. So it's important to really pay attention to the signs that are related to this and seek care a little bit earlier as a woman, because it can be disguised. It can go undetected for a significant amount of time, and then it can become dangerous.
Deborah Jackson was a healthy 58-year-old woman and shocked when she had a heart attack 5 years ago.
At the time, and I actually had the heart attack, I was getting ready to train for marathon that year.
Not only are signs of a heart attack different in women, but women are also more likely to disregard those symptoms. Jackson's heart attack presented as nausea. Like many women do, she brushed it off, worked in the yard, and even went on another run until her husband insisted she go to the hospital a couple of days later. She then had a quintuple bypass. Dr. Kerouac said women ages 55 to 65 are especially at risk. Some signs of a heart attack in women include nausea or back pain, sweating, fatigue, and shortness of breath.
But from women's perspective, it's much more important for them to actually pursue and seek out care, especially if something is persistent.
And thankfully, Deborah fully recovered and is continuing to live a healthy life. Working for you, Alana Flood, 22 News.